Dr. Anuj Shah. I'm the director of Apex Heart and Vascular, and welcome to the live stream on this app. And I just want to say hello to everyone. I can see some comments now, so I know this is actually working live. November is a very important month. November is Diabetes Awareness Month. November is a month to talk about diabetes, bring it to the forefront in the mind of general public, and really work together so we can really improve health at population level as well as individual level. Because as we know that 1 in 2 adults in the US has been diagnosed with diabetes, whether they know it or not, because despite the common belief, diabetics oftentimes don't even realize that they have diabetes. So I know we have a lot of people here. Some of them have type 1 diabetes, some of them have type 2 diabetes. I want to address, I'm going to give you a generalized outline. So I want to talk about what is type 1 diabetes, what is type 2 diabetes, and why is diabetes so important? Because what organs does it affect? And the answer is every organ gets affected, but to what degree? We all know that it can affect eyes and circulation and nerves, but why is that? And most importantly, what do we need to keep in mind? Apart from prevention, screening is very important. So what are some of the screening techniques that we need to apply and make sure that if we have diabetes, we are not suffering from the consequence of diabetes? Because diabetes to me is not a disease. Diabetes is an umbrella of various disease processes together. And what diabetes is, what I would like to call a syndrome. Right? So at the end of the day, it's important that we are not suffering from the sequelae, the potentially really bad things that could happen from diabetes and diabetes related complications. So let's simplify it. First of all, most people believe, and this is how I like to talk to my patients, to break down that fundamental belief. If I ask patients sometimes that when you have diabetes, and let's say your diabetes is not in control, what do you think is happening in your body? You think your sugar is running high in the body or sugar is running low in the body? And most people will answer saying, well, my sugar is running high. And it's a trick question, but it's not entirely true. You got to start thinking of diabetes is when diabetes is not in control, your sugar is not running high, your sugar is running low. So how? Because what is insulin? Insulin is this incredible hormone that your pancreas makes. Pancreas is the gland in the abdominal area which has alpha and beta cells. Beta cells are the main cells that create this hormone called insulin. Pancreas also creates another hormone called glucagon, so this is what we call the homeostasis in the body, right? Job of the one hormone is to raise the sugar level, and the other one is to drop the sugar level. So to function as humans, to function as mammals, to function as any individuals, we all need fuel. Every single cell needs fuel. Every organ, every tissue, every cell needs fuel. So where do we get this fuel from? The most standard fuel we get is sugar or glucose, what we call it. And how does it work? That any sugar or glucose that we ingest goes from our stomach. From stomach, it gets into our bloodstream. So that's the blood sugar or blood glucose, what we talk about. And that blood sugar is what the insulin actually takes that blood sugar and delivers it to various organs. That is insulin's job. Think of it as this incredible, miraculous boat that takes the sugar and delivers to various vital organs. And when you have uncontrolled diabetes, what's going on is this insulin, either you don't have enough insulin, because that's type 1 diabetes, body not producing enough insulin, or you have resistance to your insulin. Whatever insulin you have, it can't really go and do its job. So that's the insulin resistance, which is your type 2 diabetes. In both instances, what happens is the sugar just floats in the blood, and it can't really go from your blood to various tissues, various organs, and at the cellular level. So overall body, when we think about it, it's actually missing the sugar, the fuel, the glucose. And that's why people who have really poorly controlled diabetes, their body's physiology works exactly like somebody who's starving. So that's why when people are starving, they get ketoacidosis. Body produces this acid, and I'll explain why. Same way when somebody is very poorly controlled diabetes, it also produces acid, what we call diabetic ketoacidosis. So starvation and diabetes almost always works in the same exact way. And when I tell my patients about this, it really opens up something in that blood sugar control is so vital because you don't want your vital organs to be starving. You don't want your vital organs to be without the fuel it needs. Muscles, liver, kidney, heart, lungs, you name it. Every organ system in the body would need fuel. So I think this is where most people fundamentally don't get it. They say, oh, my sugar is running high. Yes, sugar is running high in the bloodstream, but sugar is not in your vital organs. Why is that important? Because this explains the fundamental reason why diabetes causes all its complications. So what happens? Your vital organs are not getting enough sugar. What does body do? Body cannot survive without fuel. So now what body is going to do is instead of using sugar, it's going to start looking for other alternate sources of fuel. What is an alternate source of fuel the body can think of? Fat. So when your fat gets metabolized in poorly controlled diabetes, now fat is, for lack of better words, not a good substance for fuel. You know, it's like running your car on a very cheap gas. So when you run your car on a cheap gas, what happens is, or diesel, or certain part of the world they use kerosene, which is really bad fuel. What happens with these things is pollution and smoke and all these bad chemicals come out. Same thing happens in the body. When your vital organs in the body has to depend on fat, it secretes something called free fatty acid. These are bad chemicals, free radicals. They go and they cause injury. It causes plaque formation. Plaque, or atherosclerosis is the medical word. So that's what happens with poorly controlled diabetics over the years. Now the body's metabolism goes to poor fat metabolism, which leads to triglycerides, LDL, and these things can lead to atherogenosis, which is plaque formation. Where does this plaque form? Anywhere. This is blockage. Plaque is how you have plaque between two teeth. Same way inside the blood vessel wall, we have blockage formation process starts along with calcium. So where do these blockages go? Any blood vessels. Where do we have blood vessels in the body? Every organ in the body. So that's why diabetics can get trouble from head to toe. How? If you're diabetic, you are high risk of stroke. Most people don't realize, but diabetics have 2 times higher risk of stroke than non-diabetic. Goes to the eye. Eyes being number one. So why is eye exam so important in diabetic? Because eyes have small blood vessel. Anywhere blood vessels are small to begin with, and now you get inside lining with plaque formation and blockage, you're gonna start having trouble. So that's why eyes are very prone to getting diabetic related complications, and they get they get trouble in pathology at multiple levels within the eyes. They get retinopathy, they get macular degeneration, they can get glaucoma. There is the fundus, which is the very, very back of the eye. When we look under ophthalmoscope, we can see how long people have had diabetes, and there are silver linings that are there, just like hypertension. So that's why eye exam is very important. What are the other organs where we have small blood vessels? Kidneys. Kidney arteries are relatively small, so diabetes, along with combination of hypertension, will cause blockage formation in kidney arteries. Number one thing that happens is people start losing protein and microalbumin, which is very microprotein in the kidney, in the urine. Kidney's job is to protect body from losing this protein, and with diabetes, with these kind of plaque formation and nephropathy, what we call it, people will start losing protein. So that's why kidney is very important, and unfortunately diabetics in combination with hypertension is the number one reason for people requiring dialysis. So that's why if you're diabetic, I really want you to pay attention to eyes, and you need an annual eye exam. I want you to pay attention on urine, and that's why your doctor should be checking your urine for microalbumin. They need to make sure that they check for this really low level protein and make sure that there is no protein going out. So I always tell my patients that, hey, when you go to the bathroom and if you see foam when you are urinating, make sure that you get your kidneys checked, and it's a very simple urine test. Third organ that we have to worry about is nerves. because nerves also has a lining, and that gets immediately affected by diabetes along with rest of the circulation in the lower extremities. So again, lower extremity arteries are small, especially below knee, what we call the tibial vessels. They're very small, and almost all diabetics, when somebody has diabetes, which is not very well controlled, poorly controlled diabetes for more than 10 years, guaranteed they're gonna have blockage formation below the knee, and this is why diabetics unfortunately will get ulcers. And when diabetics get ulcer, these diabetic foot ulcers don't heal that easily, and this remains number one reason for amputation. That people end up going, and amputation itself is a big problem that I'm going to address upon. But I'm looking at a question. Lost my something happened and the phone froze, so hopefully I'm back live. I would love to see a comment so I know that that I'm actually live here and people can see me. Okay, great. So just going back about diabetes, we were talking, and we were talking about how diabetes can affect all various organs, from head to toe, literally and figuratively, right? So we talked about stroke, we talked about eyes, we talked about kidneys, we talked about lower extremity. Obviously, I skipped the heart, but heart disease is obviously extremely, extremely common. Diabetes is number one reason why people go for coronary artery bypass surgery, which is all arteries in the heart blocked, and what we call open heart surgery or CABG. So diabetics are also at 2 to 3 times higher risk of getting heart attack and potentially dying from heart-related complications. So that's why cardiac exam is very important. But if you are a routine diabetic with no other risk factors, you still got to pay attention to the 3 things that I said, which is eyes, kidneys, and lower extremities. Somebody was asking a question earlier that I was answering, which was when should diabetics get an eye exam? I would say once a year, at least once a year. Find a great eye doctor and make sure that you are on their roster and get your eyes examined at least once a year. And typically this applies to people who have had diabetes more than, I would say, at least 10 years plus. But if you did get diabetes type 2 later in your age, then even earlier, gotta start getting your eye exams. Again, combination. Diabetes is also this incredible catalyst, right? In medicine, I always say that 2 times 2 is not 4, 2 times 2 is 22. And it's perfectly true when it comes to diabetes. So your risk of heart, circulation problems, and in eye, and all those problems that I mentioned is 2 times more when you're diabetic and 2 times more when you have hypertension. But when you have both, the risk is not 4 times more, the risk goes 22 times more. So that's why if you or your loved one has diabetes and hypertension, you definitely need to see an ophthalmologist once a year. You need to make sure your doctor is checking your urine for microalbumin, and you need to get your feet examined, because circulation problem, I can't emphasize, it's a huge problem. Diabetic foot ulcer, actually people don't realize that diabetic foot ulcers are number one reason why people go for amputation, and it's a huge burden on people's lives, because people who get diabetic foot ulcer will get toe amputation, and they are the same people who are at risk of much higher level of amputation. I do see a question that I was diagnosed last year at 24. If you're diagnosed at 24, I would imagine it probably could be type 1 diabetes. It depends on the type of diabetes. If somebody has type 1 diabetes, it really comes down to a number of things. So when you talk about if you're diabetic, what are the few things to look for? So number one, obviously goes without saying, is blood sugar control, because that's you're trying to control all these other downstream consequences by controlling your blood sugars, which means monitor blood sugar. You really have to be somewhat obsessed about monitoring it. Otherwise, every now and then the sugar level can creep up, right? So I always tell my diabetic patients who really want to control their sugar that check sugar first thing in the morning, and then check before each meal, and check again at night. Write down those numbers. Nowadays, you have tons of different apps where you can just record it. You also have devices that you can put under your skin, and that does blood sugar monitoring for you 24/7. Some insurance companies pays for it. Some insurance still don't pay for it. And I think within next few years, you're gonna see incredible shift in the way we manage diabetes and blood sugar. But blood sugar control is very essential, and 24/7 monitoring or not, there are easy ways to actually manage blood sugar, by controlling it. So awareness is number one step. More you're aware where your sugars are, what brings it up, what kind of meals does it go up, and that can actually help really tailor your medication therapy. So that's why sugar control is number one. It can help you with your help you with managing your insulin level, insulin dosing, insulin timing. Within insulin, you can have bolus insulin that you take at night, and then you take this baseline insulin you take at night, and you have bolus insulin that you can take during the day. And knowing the sugar spikes, what time the sugars go up and not, it can truly help dosing your insulin perfectly. Whether you need more dose at night, which is your basal insulin dose, or you need more spikes. We also have inhaled insulin, which can help as well. So that's why I think knowing where your sugar spike is the number one way to actually help control the sugar, right? So what else can we do to manage sugar? Exercise. Most people forget that exercise is so important. So if you remember my previous analogy of how body needs fuel, if your insulin is either not enough or insulin is getting resistance, insulin is not bringing blood sugar inside the vital organs, inside the actual cell. At the cellular level, sugar level drops. So what happens is you're using this fat, which works as a nasty fuel, causing all kind of atherogenosis and free fatty acid, which can cause further damage to the body. When you exercise, you're allowing muscles to take over most of the metabolism as opposed to your fat cells and liver, because when you're exercising, your muscles have to keep working. So more blood has to go to the muscles. Muscles are very smart. They know the proper metabolism. So what they do is they will use more protein, which is less bad fuel, and it actually does metabolism so much better that it actually will help control the sugar in short term and will help control the sugar in long term. So that's why it's very important that people who have diabetes regularly exercise. Regular exercise makes a big difference in blood sugar control. Of course, goes without saying, if you are diabetic, you gotta pay attention to the diet. Anything with carbs is not necessarily good, right? So you gotta avoid anything with bread, pasta, rice, all those things with carbs. You have to be very, very careful. A lot of people think fruits are good. Fruits are tricky. Certain fruits are good, certain fruits are not so much. So they have anything that is super sweet. It has fructose or corn. Those things can lead to high sugar. So really adhere to diabetic diet. So anything which is good in protein is obviously good. And like white meat is good, green leafy vegetables and all that stuff. So again, that's how you control diabetes, diabetic sugar. If you're diabetic, again, I would say that apart from controlling sugar, that's just number one. Number two is making sure you don't have other risk factors, right? Hypertension, high cholesterol. So as long as other risk factors are in control, lack of exercise is a risk factor. I always tell people that if you're not exercising and if you're diabetic, that's almost as if you're smoking, because they both weigh almost the same risk. So make sure you don't smoke, make sure people are exercising, make sure other risk factors are in control. That is another very, very important tip and advice. And finally, prevention and early detection, right? So for the complications. So once again, eye exam, we talked about it, kidney, so which is just a simple urine test, and finally lower extremities. So how do you examine for lower extremities? See a podiatrist, see your primary care. Make sure when you are in your doctor's office, they are taking the shoes and socks off and checking the pulse. Diabetics should get their feet examined. Unfortunately, most diabetics get neuropathy, so they don't feel the symptoms unlike other people. So if they have a small cut between the two toes, or when they're cutting their toenails and they have a little injury, they may not even realize. Sometimes they have a wound, sometimes they have an ulcer, sometimes there is even gangrene with foul smell. And the first time they realize something's there is when they actually smell, but they don't feel that pain. So that's why an excellent feet exam is so important that that people get their healthcare providers to examine the feet, check the pulses. If you are advanced diabetic, which means diabetes has been there at least 10 years and longer, because I know some people are in their 20s, and if you're in your 20s, maybe it's still not time to worry. But if you have had diabetes for 10 plus years, then it doesn't matter your actual physical biological age. At that point, diabetes has had a chance to create trouble. So make sure trouble is not created already, right? So how do you do that? It's a very simple test. We check circulation with blood pressure testing. So how we check arm blood pressure? Same way you can check blood pressure at the ankle level. You can even check blood pressure of each toe individually, what we call ABI, which stands for ankle brachial index. Same way for the toe blood pressure, we check TBI, which is toe brachial index, and those things can tell us how's the circulation at the feet, and that actually helps a lot in preventing amputation. That actually helps a lot in diagnosing ischemia. So what is ischemia? It's lack of blood flow, where feet don't get blood flow, and when that happens, assume that somebody has diabetes, assume that they have this neuropathy, so they are not feeling these wounds or ulcers, and they have a little cut. Now this cut will not heal. This is what we call diabetic foot ulcer. This diabetic foot ulcer will sometimes take months, and in some people it may take years before it heals, because there is not enough blood flowing there. And what happens on top of that is it can get infection, right? Because diabetics, the virtue of high blood sugar means it attracts bacteria. Because the sugar is high, bacteria love it, so there is much higher tendency, and their local immunity is low because the circulation is bad. So now people get diabetic foot ulcer, which gets infected, or the other word is gangrene. And this is the number one reason why people end up losing their limbs. And I can't tell you how many times I see people who are completely fine, no problem whatsoever, living their lives, perfectly normal, and they get into a small infection of the toe or a wound, and entire trajectory of life changes. So we have coined a term called foot attack. This is what a foot attack. Everyone, when we use the word heart attack, everyone knows it's a blockage formation in the heart that causes crushing chest pain, and people will end up needing like emergent procedure to fix the blockages in the heart. Otherwise they can potentially die or have other bad consequences. What most people don't realize is diabetics often suffer from foot attack, which is you're fine, at least from outside, because you don't feel any symptoms. You're completely asymptomatic, you have a little tingling numbness, but nothing else. And then you get one infection or you get one wound that's not healing, and then you have your underlying peripheral vascular disease, which is poor circulation, and then bam, this ulcer will never heal, requiring amputation. And when people get amputation at one level, these are the same people who need higher level of amputation. If you get amputation of the toe, you may need amputation at the ankle level, what we call transmetatarsal amputation. These are the same people who end up losing their entire limb. So again, I don't want to talk about grim situations, but I have seen this story one too many times when people are long-standing diabetic, they were completely feeling fine, and then they ended up losing their lower extremities. In the United States, we're still doing more than 150,000 amputations, 80% of which are in diabetics because of diabetic foot ulcers and peripheral vascular disease related complications. Annually, we are talking about more than 20 million individuals in the US have peripheral arterial disease, and 1 million of them gets this limb ischemia. A large majority of them have diabetes. If you are diabetic with diabetic foot ulcer, your all complication rate goes 3 times more, because these are the same people. Now, the treatment of these foot ulcers will cause more complication and consequence. So that's why I always tell people that do not ignore symptoms. This is very important and essential that you get detected early on. Early detection is the key. Screening is the key. Preventing diabetic foot ulcers is the key. And if, God forbid, you develop diabetic foot ulcer, make sure you don't have peripheral vascular disease and limb ischemia. Those are the bad news. The good news is limb ischemia it used to be a very difficult disease entity to treat or even pick up. The good news now is it's gone much easier. We can detect, and we can first of all prevent limb ischemia, by doing all the things that I mentioned, and which is what I hope everyone does that. But God forbid somebody develops limb ischemia and poor circulation, it's very easy to detect. As I said, blood pressure of the ankle, blood pressure of the toe. We also have sensors now, which we can put on different people's toes, and the sensors can tell us if someone has has limb ischemia and poor perfusion at the skin level or not. And finally, the treatment has gone so much easier. Back in the day, this would require amputation, amputation, amputation. That was the only therapy. Now, we as interventional cardiologists take pride in providing something called limb salvage angioplasty, which means we have all these different tools and techniques that we learn from fixing people's coronary arteries in the heart. We apply those in the lower extremity arteries, and we can open all these blockages and still prevent people from having to go for an amputation. Having said that, not every center, not every place has this expertise. So that's why it's important that that anyone who has to go through this gets the right kind of testing. Which again, sometimes it requires educating even the doctors and providers, because you would be surprised at how many people were trained like 20 years ago and they don't even know all the advances in peripheral vascular disease that's going on. Even the medical therapy of this disease entity has grown tremendously. So, I always say save limbs and save lives. And it's very possible and plausible in today's day and age. And I have dedicated my career in saving limbs and preventing amputations. And in turn, that translates into people living longer, living healthier. So that's my talk on the amputation prevention. I'm trying to look at some of the questions here. What kind of situation require amputation? We just talked about it. People with peripheral vascular disease, people with critical limb ischemia. So, and how to prevent it, how to detect it, how to fix it. And it's truly a shocking number. If somebody has diabetes for 40 plus years, I would highly urge that make sure your heart's okay, make sure your circulation is okay. It's very simple, easy to pick up and prevent and fix, God forbid, if needs fixing. So that was on the amputation prevention. Once again, I can't emphasize enough that cardiac exam, making sure that your EKGs are normal. If you have any symptoms, diabetics don't get classic symptoms. That's unfortunately the reality. So we always know that people who have coronary artery disease, they will have this crushing angina, which is elephant sitting on your chest. Diabetics don't get that. I can't tell you how many times diabetics come to our emergency room with a heart attack or blockages, and they never had those classic symptoms. So any symptom in diabetic, absolutely don't ignore it. If you happen to even not have any symptoms, but you have long-standing diabetes, ask your doctors if there is anything else you can do to reduce your risk. If there is anything else we do to make sure that if you happen to have disease, how to pick it up, how to detect it, and how to fix it. Other questions are anything we can do to prevent neuropathy from worsening. Neuropathy is a very tricky disease. It really comes down to proper glycemic control. Getting diabetes perfectly under control is the key. Unfortunately, sometimes the horse is out of the barn and people do develop a lot of neuropathy symptoms. I would recommend a few things. Number one, make sure that you have tried all different therapies. There is gabapentin, which is a great medical therapy, which is very standard of care. There is a new one called pregabalin or Lyrica, which was only in neuropathy from herpes zoster patients, but now we have found that there is role in even diabetic neuropathies. So that would be another thing. There are ways to detect how bad the neuropathy is by doing nerve conduction studies, where we can actually see how quickly a nerve is transmitting electricity, basically from like one synapse to the other synapse. So make sure you get those diagnoses. And as I said, the key is really controlling the diabetes. There are a lot of new advances and a lot of buzz about stem cell therapy, using artificial intelligence to detect and pick up who are the people who are going to get neuropathy as time goes. Unfortunately, those things are still not commercial, but hopefully in our lifetime we will get to see some of this incredible technology coming out and helping us in detecting, making sure who is at risk for neuropathy, who's going to get neuropathy. Same thing for lower extremity. We have these smart socks, we call them. They do temperature monitoring of your lower extremities and can say that who's at risk of neuropathy, who's at risk of peripheral vascular disease, who's at risk of developing ulcer, because there are two areas between the two toes are always cold compared to rest of the toes. It knows that there is lack of perfusion there, and it can warrant that more frequent examination, more frequent feet care and stuff like that. Another question is angio with balloon stent in the left leg and the right leg in a few weeks. it's a very standard procedure nowadays when people have blocked arteries. There are a number of factors. Today's day and age, it's for us for who do this procedure every day. This is a very routine. I myself did like 7 of them today, for example. So we do this a lot. It's possible to open most of the blockages. Having said that, prevention is the key, detection is the key. I always say not every blockage has to be open, right? So discuss options with your healthcare providers that are there other intervention related options. There are certain medical therapies which can improve circulation. Most people don't realize, but exercise. If your legs hurt when you exercise, that's peripheral vascular disease. And funny enough that if your legs hurt when you exercise, the treatment is actually exercising beyond that. So you push through the pain. Your legs hurt, you keep pushing your leg, you exercise more and more. What it does, it creates collateral flow. So assume that your one artery is completely blocked. And what body does, it prevents collateral. Collateral is your natural bypass. So think of this as a highway. If the highway gets clogged up, like there is a complete congestion of the highway, you form detours. So that's what collateral is. And what helps building up collateral is exercising, pushing yourself beyond pain. Obviously, blood thinning medications can help. But finally, at the end of the day, fixing blockages with balloons and stents have become very routine, very easy. If somebody already has developed resting ischemia, limb ischemia, which means even at rest, the feet are not getting enough blood flow, then really fixing the blockage is the mainstay of therapy, and it has some phenomenal results. So again, any other personal specific question, I'll be happy to answer. But we are very lucky that the science has advanced in that sense. Another question is, my endo hasn't mentioned complications at all. Glad to know. Yeah, absolutely. Again, younger you are, less likelihood that you're gonna develop these complications. But again, the actual physical age doesn't matter. The number of years with diabetes is what matters. Diabetes is very aggressive atherosclerotic factor. So longer the diabetes, higher the risk that you can develop in all these complications. Yeah, their feet are always cold October to April. Could be diabetes related complication. Again, it's very easy to detect, as I said, to pick up these kind of blockages somebody has or not. I would highly urge that if your feet are cold, if you're having leg pain, if you're having discomfort, achiness, some people feel their legs are always cold. Some people feel that they have restless leg syndrome, which could also be a type of vascular disease. Some people have extremely dry skin. They feel like they constantly need to scratch, and that actually could be a circulation problem as well. Oftentimes swelling, edema, discoloration of the leg, blue black spots on the legs, people getting Charlie horses and getting cramps middle of the night that wakes them up from night. These could all be serious circulation problem. And again, the detection of all of this is so easy nowadays. So don't ignore any leg related symptoms. And again, if you are somebody who's 65 and up in age, you can just get simple circulation testing. I would say 50 and up, and if you have diabetes for more than a few years, then you can get simple circulation testing without any symptoms. Not only you can, you should. So that's my recommendation, that don't ignore any symptoms. And if you're 50 or above in age, then even with no symptoms, get simple circulation test. And if you have any small ulcers or wounds, 100% make sure you don't have any compromised circulation. So once again, it's been a pleasure. I don't know how long we've been chatting, but I want to summarize everything I said. So once again, diabetes is a systemic disease, whether it's type 1 or type 2. They both have consequences on the body, on every organ system. The underlying main mechanism is the type of fuel body needs is different now, right? So that's why sugar control is extremely vital. Making sure other risk factors like cholesterol control and lipid control and blood pressure control is very, very important, like more important in diabetics than non-diabetics. And making sure that you get routine care, which is diabetes control, eye exam, making sure urine gets checked for microalbumin, feet examined, pulse check, and if you have any symptoms, then definitely get circulation tested. If you are 50 and up, definitely get your circulation tested. Same thing, any cardiac symptoms, 100% don't ignore it. Make sure you have routine EKGs and presentation. Once again, thank you so much. And it's been a pleasure chatting. Any other question, I'll be very happy to answer. Thank you, Megan. Thank you, James. Thanks, Sean. Thank you, everyone. Thank you, Leslie. So once again, if you're diabetic, November is a very important month. Let's all work together. Let's raise awareness. Let's make sure we protect ourselves, our loved ones, make sure that none of us are suffering from any consequence or complications. Any further questions, please feel free to reach out to us. I'm sure my information will be here somewhere. I will be very happy to answer any other questions on one-on-one, whether it's an email or you guys want to visit my website. Okay, on that note, have a great evening, everyone. Our website is www.apexheartandvascular.com. And we are available. You can just contact us over there. I'm even available for virtual consults if somebody needs to get more one-on-one attention. Once again, I'm not an endocrinologist, so I think I can recommend people in the right direction for blood sugar control, which has, by the way, tremendous advances. Didn't even get a chance to talk about it, but there are certain diabetic medications, especially two new ones, Farxiga and Jardiance. They both came out with incredible data. This is only for type 2 diabetics, and there is a benefit in preventing and treating congestive heart failure. So diabetes and heart were always connected, but now we are learning more and more that there is even bigger connection, not only in terms of diabetes just being a risk factor, but the treatment. Actually, the same drugs can have diabetes type 2 can also help congestive heart failure and heart problems. So again, we'll be very happy to discuss any and all of it. So it's Apex, APEX, heartandvascular.com. I'm based in New York and New Jersey, and we'll be very happy to answer any of your questions. All right, take care, everyone. Have a good one. Yay, New York.